My name is Lauren Carr, and I serve as the Opioid Settlement Advisor here at KCO. I'm honored to guide us through this critical discussion on how counties can play a critical role in preventing overdose deaths and implementing effective response strategies. This session is designed to inspire, inform, and equip you all with actionable ideas to strengthen your local overdose prevention efforts. As counties navigate this process, you might not think that this falls on a county level, but we all play a role. And we have an outstanding lineup of speakers who bring a diverse expertise and firsthand experience in implementing life-saving efforts. But I do just want to say thank you for your leadership on a local level, because this is essential in creating a healthier community. So let's get started. Just kind of a reminder, we have started this new webinar series. We are going to be launching opioid solutions, and each month we are going to be showcasing different counties across Kentucky and how they are utilizing opioid settlement funds, or what could be used for opioid settlement funds, and how best practices and innovative approaches. So be sure to register for this webinar and also share it with your peers. Just another quick tidbit before we go into this discussion. We do have a resource library, so if you are familiar, please look at that. We have some sample templates, and we are continuing to provide education on this space. And with that being said, we have an upcoming training that's in person, and it's going to be at the KCO office in Frankfort. You can scan that QR code right there, and you can register for it. You can look at our tentative agenda and see we're going to have an all-day training to really digress and talk about ways that you can utilize these funds. So more information to come on that, but I just wanted to get that on your all's calendar. So if you all can attend the in-person training, please do. Okay, so this brings us to the heart of today's discussion, overdose response. Counties play a critical role in shaping how overdoses are addressed on a local level. Today, you'll hear from peers and what steps they are taking to reduce the harm in their communities with collaboration, understanding, and empathy. On the screen, you'll see some of the allowable uses outlined in the opioid settlement agreements for preventing overdose deaths. While every community has its unique challenges and needs, each of you have the opportunity to drive meaningful change. Now, let's hear directly from your peers that's working on the ground. We'll hear from west to east, as we have McCracken and Powell County leaders that will share how their counties are tackling the opioid overdose crisis. First is McCracken County Sheriff Ryan Norman. Sheriff Norman began his career at McCracken County Sheriff's Office as a road deputy and progressed through the ranks before becoming sheriff in 2022. Sheriff Norman was a detective in the drug division, led the general investigation unit as a sergeant and a captain, and then promoted to the position of chief deputy prior to being elected as McCracken County Sheriff. Sheriff Norman has a very innovative approach with Badges of Hope, which he is probably going to talk about more. So he has an extensive background and is a good community partner. Sheriff Norman, I turn the floor over to you.
Thank you, ma'am. First, thanks for everybody that's joining us here and taking a minute to listen about these important programs. Lauren said a lot about kind of what we're starting to do or have been doing here, and honestly, we're just a cog in the wheel, and just try to be innovative in some solutions to issues that we as law enforcement saw. And I think what I try to keep in mind is that it starts local. A lot of it's obviously a national issue, but and statewide issue, but everything starts local. We know the people involved in these types of incidents and situations. We see it on an almost daily basis, and I think it starts local. It's our communities. We love our communities, so we need to try to be a part of the solution. And I know today we're discussing QRT, the Quick Reaction Team, but our journey, the sheriff, McCracken County Sheriff's Office journey into partnership in QRT really started and was enabled by our Badges of Hope program that we started in 2018. And we began that simply because as law enforcement, we would go to incidents and calls where we did not have a good solution, a viable solution to help somebody that at that moment in time was saying, "Hey, I have a substance use disorder and I want help." Our go-to was here's a number, call it. We can try to get somebody here to help if it's during daytime hours, but if not, you can call tomorrow. And good luck to you, because our only solution, and historically, I think it's been law enforcement solution was jail. If we can't arrest somebody, hey, we'll talk to them for a short while, but we have other calls to go on, and so if they're not going to jail, we'll try to help you out here, right here and now. But we've got other calls, other things to do. Other organizations may be able to help you. And it was a very small time frame that somebody could speak to somebody on the phone or go somewhere and get the assistance they needed. So seeing that issue that we had on lots of different calls, the former sheriff, Sheriff Matt Carter, began Badges of Hope in 2018, and it started small. I mean, and it is still relatively small, but I think the uh, what we have accomplished isn't small, I guess. But basically, it started with one local treatment facility here, agreed to anytime we would bring somebody to their treatment center, they would start treatment on them that day. We still had some issues. It was still the mainly daytime hours. We'd have a contact after hours, but it still wasn't great. But it was a starting point. And the main thing behind that was we had some go-to place we could call pretty much 24/7, and we removed one of the biggest barriers that we as law enforcement saw, which was transportation. The two biggest barriers were how to get to treatment, especially that initial treatment, and where to go, who to call, where to go to get this treatment. And we removed those barriers, or at least attempted to remove those barriers at the very beginning. Because when somebody, in our opinion, what we saw in our experience was if somebody wants treatment right now, is saying, "Hey, I need treatment," we need to jump on that, because in 8 hours they may change their mind, and certainly in 24 or 48 hours their mind might be changed. So we need to take the initiative and jump on it right right then and there. And one of the things, and this is related to QRT, but we were fortunate that we started overcoming Badges of Hope, was a culture change within our agency. And like I said, in law enforcement, historically, it was take somebody to jail or talk to them for just a few minutes, give them some pointers, give them some phone numbers, and we're on to the next call. And it took a little bit for culture change here, and it still progressed into 21, 22 as we got new employees, and this our initiatives grew even more, because it was a different, I want to say mindset, but it was a different um, way of doing business for law enforcement. We aren't social workers. We aren't equipped with the tools that social workers had, and that was a little bit of the pushback that we would see. That we're not social workers. There's crimes being committed. If not here, then down the road that we need to take a look at, investigate, and go to. But when leadership and those really involved in investigating drug trafficking and those sorts of crimes uh, really uh, tried to put this at the forefront of people's minds. We started seeing the change in the mindset. Um, and what I like to drive home is that we all live in this community as well. Um, just because it may not be happening next door to me, what happens across the county or a neighborhood over, it does affect my family's life. It does affect deputies' families' lives. And there's not very many people within our community and probably across the Commonwealth that have not been infected by illegal drug use. Or prescription drug abuse. It probably affects just about everybody. So our culture change really started with the Badges of Hope program, and the Badges of Hope program has progressed exponentially from where it began, in large part to somebody you're going to hear from later on, Brandon Fitch. He was instrumental and still is instrumental in the success of Badges of Hope. The Purchase Health Department has assisted with grants. And one of the things when we started talking with Brandon about QRT that was on the forefront of my mind was the cost and time. And our experience with Badges of Hope was there isn't a whole lot of cost and there isn't a whole lot of time on the sheriff's office part with Badges of Hope or QRT. So when we agreed to be a part of QRT, kind of knew that going in. There's the time is minimal, cost is minimal, and at the end of the day, what better can we as members of the community and law enforcement do than try to get somebody on the road to treatment, try to prevent an overdose, try to prevent the generational cycle of substance use disorder. So kind of transition to QRT when that started. Again, that was at the forefront of my mind, and the culture change wasn't as big of a shock. It still was a little bit because QRT means going out after the fact and just being a face there with treatment providers to say, hey, law enforcement is here to help. So it was still a little different than taking the initiative and trying to get somebody to treatment right then and there because we're not active in the QRT portion other than being there and this uniform being seen as somebody that's just trying to help and that's it. Um, and kind of how I have uh, approached it within our agency is that we have a three-prong approach to the drug trade at the sheriff's office. We are absolutely going to go after drug traffickers and lobby for severe penalties. But on the other hand, we're going to attempt to assist to get users into treatment. It's a win-win for us as an agency. It's a win-win for the criminal justice system. It's a win for our community as a whole. Um, so there was still a bit of a culture change within that, but at the same time, I made it very apparent that we're still going after drug traffickers, the ones that are poisoning the streets, and the users that want the treatment. We're going to assist them in getting into treatment. Um, and it wasn't that big of a deal once people got involved, once deputies really started going out on these QRT calls and getting involved. And there are several deputies that want to be more involved. And if there was more time, they would probably be extremely active in these little parts that we play. That they love being helpers of the community. And one of the things too that has been mentioned and to me and I didn't really struggle with but I did think through was again the cost with QRT and isn't there other things that law enforcement can be doing and my answer to that is one, the cost is extremely minimal. Other calls aren't being held because of this. Our partners in this, Brandon Fitch, they make it extremely easy for us to schedule a QRT visit. Um, and they are very understanding that, hey, other things come up and their team may be waiting a few minutes for us. And then the other thing too is that, in my mind, um, you know, government does have a role in helping lead someone to recovery. As law enforcement, I think that the government's main role is to um, protect citizens, and that helping lead somebody to recovery is helping protect citizens. Not only is it getting that specific person help and protecting them, but we go to call after call where you can see um, the what happens with the generational substance use, and when you see grandkids living in conditions that we do, and it's the underlying cause is substance use. Um, I don't think you can be human if you don't try to help that and don't try to stop it. Um, so we we've had success with QRT. We are extremely proud to be a part of it. The time definitely has not been an issue. And like again, I can't sing Brandon's praises enough. A lot of the successes and the reasons the time probably hasn't been that much and the commitment hasn't been a ton is because of Brandon. He makes it so easy, and his organization makes it so easy.
Thank you, Sheriff. And if we have time at the end, we'll have questions for everyone. And again, this slide deck will be sent out to everybody. But I want to get next to our next speaker. Now we're going to hear from Powell County Judge. Now we're going to hear from Powell County. Eddie Barnes has served as the Judge Executive of Powell County since 2023. He resides in Scranton with his wife, Dawn, and 3 children and grandchildren. Judge Barnes is a retired lieutenant firefighter paramedic from Winchester Fire EMS with over 36 years of dedicated service to Powell County. He began his career in 1986 as a police officer with the Scranton Police Department and later joined the Powell County Sheriff's Office. His extensive experience in emergency services includes working as an EMT, serving as a paramedic in Powell County Ambulance Service, and leading as the Powell County EMS Director. A longtime member of the Scranton Fire Department, he served as the fire chief. I met Judge Powell and their working group as they were working on opioid settlement funds and addressing their overdose crisis. Judge Barnes, the floor is yours.
Yes, ma'am. Can you hear me? Good morning, Lauren. Can you hear me?
Yes, I can hear you, Judge.
Okay, super. But first of all, for having me. I appreciate it. And Lauren, I just want to say a big thank you to you for what you do for our community. You've actually helped us out a lot as far as understanding the opioid settlement funds and how to distribute them and all that. But you do an excellent job, and thank you so much for that. As far as the QRT, uh, I want to say also thank you to Janelle Brewer. She was instrumental in getting this to our community, and a lot of the volunteers that work here. As the sheriff said, all of us are affected by overdoses, drugs, and how can we fix them? Well, it's going to take a long time to actually fix them, but we can help people understand the addiction and give them information about how to get help. And when we talk about addiction, as the sheriff said, it doesn't only affect the person, it affects the families. So that's one of the things that our county has started working to allocate opioid settlement funds to address our local needs. And Keiko has been wonderful about assisting us in setting up a work group to ensure these funds are used effectively. And Powell County has one of the highest overdose death rates in Kentucky. We're ranked #4 out of the state. And like I said before, all of us know somebody that has been affected to this. Um, my son's an addict. He was raised properly in a good home, but it happened. So, right now he's clean, thank God. And, one of the things that the projects we're funding is partnership in our local health department to expand harm reduction services for individuals who have experienced an overdose. Because a lot of these people, like I said, they don't know what to do, how to do it, where to go. Um, and hopefully that's what this QRT will be doing. Also, we're exploring a workforce development program in our jails to help people get back on their feet. Um, while we're still in the early stages, we're grateful to be taking action to support our community. And this is what it takes, is a community support, like we always say, it takes a village to raise an idiot. And so let's all join together and raise a bunch of good guys and girls and get back on our feet. And QRT, I can't say enough about them. The people that is on our teams, most of them volunteer to be here, and along with our police department, ambulance service, fire department, health department, and local mental health agencies and stuff. They're doing an excellent job. And I'm really not much on speaking, so I will shut up now and turn it back over to you, Lauren. But thank you so much for having me, and we appreciate your help.
Thank you, Judge. Thank you, Judge. All right, we're going to get into what QRT is, all these different ideas. And I just want, sometimes when you hear the word team, just kind of like the sheriff said, you think, how much is it going to cost? It's a big program. Well, we hope to share with you how it can be implemented in your community. And so I am now going to introduce I'm excited to introduce Dan Malloy. He's the Director of Operations at Operation to Save Lives and QRT National. With his expertise in fostering collaboration among public safety, public health, and community leaders, Dan will share how these efforts are creating community-driven responses that challenge faced by individuals with substance use disorder, mental health, and behavioral health challenges. Additionally, you'll hear from leaders from Four Rivers and Pathways on their local initiatives and how they are doing the work in their community. So Dan, the floor is yours.
Thank you. Again, just like Chief Barnes and the sheriff, it's an honor to be with everybody. It's an opportunity to take time and see the energy in the room and feel it. I'll be honest with you, Sheriff. We could use you on the road. We could use your leadership and your champion. You talked about things such as culture change and continuing to educate and continue to listen and continue to learn. And that's the field. And what I'm going to do here very quickly this morning is talk about this from a national perspective, and then how it ties back to the state of Kentucky and how it ties back to our region of Ohio, Kentucky, and West Virginia. Could you flip to the next slide? This was a statement that was made back in 2015, tied back to this health scientist from the CDC. And my background is, I'm from Southwest Ohio. Spent almost 30 years in public safety service. I was a police officer, promoted just like through the ranks, and then I became the chief in 2007. Served that role 7 years, and then in 2013 I was promoted to take on law enforcement and fire EMS services. So I spent that leadership role, they called it the director of public safety, for the last 5 years of my career, and retired in this city manager role in 2018. During that time, we were faced with this battle of how do we change our response? How do we work collaboratively? How do we think about this differently? Because no matter where we were, no matter where I was, I live in the community that I worked within, so it didn't matter whether it was church or at the grocery store or at the ball fields. The question was always would turn back to, are we doing something about this? Are you guys involved in something like this? And these questions go back to 2010, 11, and 12. And I realized that the role of a leader is to try to understand and try to work through things that we may have never been trained for, never presented with before, and never given the tools for, and we weren't. Like the sheriff said, we were given one tool, and that was the court system. And that system, and along with the jail and the prison systems, were to address all facets of this disease. And the reality is, the traffickers, absolutely, but there were a lot of victims in this space that were in need of assistance. And we, as a profession, call that problem solving. Law enforcement defines a problem as two or more incidents that are similar in nature, where there's an expectation from the community that we will do something about it. When you look back to this opioid crisis and you recognize two or more overdoses, two or more break-ins of a car, two or more burglaries, two or more robberies focused around property to then turn and sell at a pawn shop, all these things, they fit that definition. Two or more incidents, we had plenty of twos, but we weren't working collaboratively. So back in 2012 and 13, that was my goal: build the collaboration, find the partners, and try to understand what addiction meant. And we didn't even know what recovery was, because that's not something that we were ever taught, but we had to get in the rooms and learn from folks to help us explain, how do we fit into your service? How can we work collectively together? And again, to this comment, effective synchronized programs to prevent drug overdoses will require the coordination of law enforcement, first responders, mental health, substance use providers, public health agencies, and community partners. And I thought, there's someone other than me, as a police chief, as a director, whatever you want to call, saying we need to work collaboratively. And that's what we did. So in 2013, we started this idea of law enforcement, fire and EMS, and the right community partners being in partnership, working collectively, and we called it the Quick Response Team. It was, yes, it was focused around opioid overdoses. It was focused around active outreach, engaging with those who had yet to overdose, domestic violence survivors, elderly, mental health, crisis intervention, those kind of things. But because of what was happening at the time, 98% of the work was really driven by the opioid and substance use crises. So that's where our work played. And the next slide, Lauren. This is kind of where the conversations are happening across the country. So Kentucky's right in the middle of that. In 2019, the state of Kentucky and the Cabinet of Health, Dr. Amanda Foley, reached out to me and said, we heard about this thing called QRT. What does it mean? It means we're working together as a community collaboratively to multiply ourselves. So no one agency has to take it all on. And we're figuring out how to respond within our community to provide connection to resources, but also to engage individuals and families before the tragedy occurs, so they know that there are trusted and respected help partners in the community. Meaning, like the sheriff said, what's our role here? We were the delivery system. We were the partners to show our community that we're working collectively together with a lot of smart people that know how we can get connections and make help happen. We were a representation that we're part of the community, so is fire and EMS, and that when you see our vehicles moving up and down the street, that someone in there knows that, you know what, we can ask them, can you help us? And we have the partners in our community to get you connected. So that's how that works. And collaboration looks different in every community, and that is the flexibility of it is really what works best. And what you're seeing in this map is, the map before, I'm sorry, is in 2023, we had a National Day of Deflection, and we partnered with 11 or 12 states, and Kentucky was one of those partners. And these states for 24 hours said, what does a QRT do? What does deflection look like? And these teams worked and reported back and shared all their information about whether it's community education, distribution of Narcan, follow-ups and engagements, finding new partners, delivery of meals, providing hygiene kits, whatever it was that was important in those states. That information was, no one had ever looked at one day of what this work looks like. And that's what we did in 23, and we did it again in 2024. So that's the conversation. So it's not just a Kentucky conversation or an Ohio conversation, it's a national conversation about how can we work collectively together. Next slide. Not to build too much, but you hear things about law enforcement and their role. In 2015, the chief of Gloucester, Mass, so fishing community, and the chief they were inundated and he didn't know what to do. So he posted on Facebook that June day in 2015 and said, anybody needs help, come to the PD. The first person that walked in the door asking for help got on a plane in California, flew from California to Boston, drove to Gloucester, Mass, walked in the door and said, I need help. That's how difficult at the time, 10 years ago, for people to find trusted partnerships, find people that would be willing to help and that would treat them with humanity and compassion and provide assistance that they could trust. That young man today has a master's degree and he's working in the field and he's doing great work. So that first person to kind of kick some of this stuff off is still doing today and working in the field. So that's where this nexus of this piece focused nationally around this. And now the conversations around pathways, around deflection. You hear that word. 9 federal agencies now use the terminology of deflection in their organizations. That's the difference. And I'm not going to take time. You can read this. The difference between deflection and diversion simply is deflecting. So our officers go out on the street, our team goes out in the street, we meet someone and we have a need identified. We can deflect them to our partners in the community, whether it is the QRT or it's other partners that we have relationship with. So we don't have to use that tool. We have to figure out how to arrest them. What's the charge? Take them in front of the judge and let the judge decide how best to serve this purpose. That's the way I was raised. But the reality is the court system wasn't set up to be that. But that's the way we were taught as a young police officer in the 80s and the 90s. This is the difference. We now partner with communities and we have the opportunity to get help before engaging the justice system. Diversion is, think of the drug courts, post adjudication opportunities. You have the ability to, if you respond and serve in the space, you meet this training expectation or this education piece, then we can divert your crimes away from that. We can work off those crimes, so to speak. So, but that information will be in your packet. And this is just a more of a breakdown on the formal difference of deflection versus diversion. Formal booking, yes. Diversion sometimes, yes, no. That's just kind of a nice, easy checklist. Next slide. There are 6 formal pathways, and then in the state of Kentucky and several other states, you'll see there's a 7th pathway, and that's the growth and the evolution of this work. Self-referral means you can walk into any place. The Kentucky State Police, at every post, you can walk into any one of those posts and say, I need help, and they can help get you connected. Active outreach is we want to get engaged with people before a tragic event happens. We don't want the overdose to occur. We don't want the family to experience this, the individual to experience this. Because if you're like me, you know, we just put out a health alert. I'm the president of our Hamilton County Board of Health. We just put out a public alert that carfentanil, we believe, is back into greater Cincinnati and Southwest Ohio. That kills a lot of people. We don't want that incident to occur. So if we have active outreach and we engage with folks that we know in our community and we're trusted, guess what? We can get them connected, provide resources, be a phone call away that if help is needed, that's what we can do. Post-overdose outreach, that's the QRT. We can follow up, we can do that, engage with the family, provide connections, provide resources, start that trusted and credible relationship. So when they're ready, they give us a call, we'll get them connected. That is the piece there. Officer intervention, that's an arrest at, say, a box store, a Walmart, a Myers, a Target, and it's they share the information that, you know what, I have a problem, I have a drug problem. This is what I really don't want to be in this position, but I am. You can offer them the connection to help. You know, we can get you connected. Would you be interested? Yes. That's the opportunity for that officer to make that decision, to provide the connection. Maybe they hold those charges in abeyance until that, or they file the charges and they move to the drug court. It's basically a local decision, how it works. And then the community responder and co-response is a partnership between law enforcement, public safety, and the community, whether it's behavioral health, public health, peers, whatever. Or in community responder is a program that's solely community. There is no law enforcement partner. There is no public safety partner on the team. You see that in Oregon, it's in Denver, but in the state of Kentucky, we have teams that work this way. You know, and because of the partnerships or the lack of short staffing within local communities, that law enforcement isn't necessarily available. So it becomes peers and behavioral health, or public health and peers. It's really what is available within each community. The next slide, please. And you can, this is just more details and you can see that in your notes. So go ahead and through this to the map. The other piece is the situation table. The situation table in the state of Kentucky, and you can see across the country, Kentucky is the second largest state for the situation table. And what the table is growing off our partnerships that are built by the community QRTs, the ability to collaborate, the partnerships necessary, but what teams are experiencing is they're recognizing when they walk into homes or they engage with family members that there's more than just substance use occurring. There are more needs within this family or this individual that is beyond the scope of the QRT team, whatever that makeup is. The situation table addresses 27 different risk categories and 105 specific risks. So whether it's youth focused, elderly focused, domestic violence, mental health, substance use, criminality, basic needs. We don't have food to eat. We don't have a place to live. We don't have, those are the kinds of things that we're experiencing. Now we are able to come back to the table, which is built up of participants all across our community. So it's not just, like I said, law enforcement, public safety, fire EMS, substance use providers. It's the schools. It's local government, it's anyone and everyone, the hospitals, it's workforce development. You heard Judge Barnes talk about workforce development. It's those folks coming to the table to say, situation by situation, how do we work in the best interest of this individual, this family, to move them from what we call acutely elevated risk, meaning risk and harm is about to happen. If we do not engage, bad things are going to occur. So we want to intervene and provide access and resources and assistance to pull this family or this individual from that cliff, so to speak, of like, we got to get there and we got to help them before they fall off that cliff. So pull them back, get them the help and the connections that they have. And like I said, in the state of Kentucky, we have 10 tables and we hope to continue to grow and build more. But next slide. This is where tables are across the country. You saw the listing. This is missing a few states. You know, Rhode Island should be on here. There's a couple other ones that Arkansas has just started. So these are states that are growing this conversation and happening, and the situation table is a really great add-on to what the state of Kentucky was already doing with the work that's happening with the QRTs and the Badges of Hope, this collaborative spirit that's happening and occurring across the state. Next slide. This is the state of Kentucky. When you say what's happening across the state of Kentucky, and you're like, man, that's a lot of color. There's a lot of, because there's a lot of things happening, and it's actually missing one because just this week, Franklin County, the city of Frankfort should be added to this effective this week. So there's one more county, one more community that's doing this kind of combination. What you see is core funded teams. You see abatement funds teams. You see the red checkered is all the spaces that are operating QRTs and operating a situation table. And then you see the purple is where they may be the entities such as Turning Point, Boyd County Pathways. They're serving areas greater than what they're being funded for, meaning other communities are saying, can you help us? Can you help us understand or educate us or be a partner with us as we continue to have these conversations? So you see that, you know, Perry County serving over in Knott, and Johnson and Floyd, Mount Comp working over in Pike, and you see Powell is helping Breathitt, you know, as Breathitt's starting to launch what they're doing, and you can see what's happening over here in the western side with what Brandon and the sheriff are doing. There's other folks having these conversations about how do we serve differently, and it's okay. Because that's the world that we are in. We're about helping and assisting and giving each other resources and services. And a lot of good people working in the state of Kentucky to provide assistance. So there's a lot of different funding agents. Public health has stepped up and they wrote a grant to fund 2 more situation tables in the state of Kentucky, from 1 in 25 and 1 in 27. So you have, you know, a multitude of opportunities for communities to say, I would like to do something like this. And there were 23 applications to the Corps where they were able to fund 7 communities. There were, I think the rumor, and I can be wrong, but the rumor is like there's 200 plus applications to the abatement for this last cycle, where communities are trying to drive innovation and drive change and collaboration. They're absolutely really good work happening. So it's continuing to grow and continuing to evolve. Next slide, Lauren. Next slide, please. There we go. And you can just keep going, just keep going. Oh, I don't want to take any more time. And really what this last slide is, there's so much more happening when you start driving community and collaboration, is the requests for service. Why? Because these teams have become trusted in their communities. So we talk about nationally that we started with an opioid crisis, but it became larger. You talk about alcohol, you talk about family members and loved ones. How are we serving them? What resources are we providing to them? Drug exposed children and trauma, mental health disorder, domestic and intimate partner violence survivors, violence in the communities, youth and young adult at-risk populations. These are all the conversations that are happening, not only in the state of Kentucky, but across the country, as we're recognizing that working collaboratively, bringing partners and experts to the table so we could talk through what does our community need and how can we work together. Those things are happening, but they're also, again, they're happening at the tables in the local communities in the state of Kentucky, which is something that I'm very, very proud of. So I appreciate your time, and I look forward to hearing from Brandon and Rodney and Crystal.
Thank you, Dan. And we're going to save room for questions. So up next is an example of a local community. So Sheriff Norman talked about Turning Point and Four Rivers Behavioral Health. So I'd like to introduce Brandon Fitch to talk a little bit about his program and what they are doing in Western Kentucky.
Thank you, Lauren. Thank you, Dan and Sheriff Norman, for kind of introducing what we do here. As Dan had mentioned, first off, I'm the director of Turning Point Recovery Community Center, which is part of Four Rivers Behavioral Health, and we service the 9 most western counties of Kentucky. But we're going to talk today kind of about what we have been doing in McCracken County specifically. So as he had mentioned, QRTs look different. They are comprised of different entities, different leadership, but I'm going to tell you how ours looks. Back in 2019, we had received funding from the state of Kentucky to begin this process. Of course, COVID happened, and we were unable to really hit the ground running. But our very first partnership actually came from our connection with Lauren Carr in her Mayfield times, and connected us with the local PD there in Mayfield. So we were able to form that connection in the very beginning. I want to talk about how we formed ours and how we operate. During our overdose awareness event that we were presenting, we actually were approached by Sheriff Norman, who was looking to expand how he responds and how his Badges of Hope program responds to overdoses. And that's when we had the opportunity to start that partnership. He had mentioned that the leadership buy-in is extremely important. And I say that every successful quick response team partnership that we have has a champion at the top. And that is so very, very valuable. We also recognized that law enforcement has a lot on their plate, and it has a lot of work to do. So we needed to take this opportunity to make this as streamlined as possible for our partnership. So what we basically did was create a situation where they can simply refer their interactions with individuals to us and our team, and I'll go and expand on that here in just a moment. Our team works with the law enforcement to find a time to meet that individual at their homes or at their last known locations to provide them support. And it has worked out extremely well. The cost is very minimal. We have a staff here that is paid through state grants. The same can be done with an opioid settlement, and we've used that for other programs as well. The team is comprised of folks who are like-minded and want to help people. So it doesn't require a full-time position to be on the team. But we have folks at the health department, at the local hospital, here at Four Rivers Behavioral Health that mobilize when this time is right to go respond to an individual who's experienced an overdose. So we have been very, very successful in that. Again, it comes from that leadership. It comes from that champion with the sheriff's office that has helped us make this possible. So far this past year, between our referrals here in McCracken County only, we have received and responded to 153 overdose survivors and their families. Many of those are from the sheriff's office. Many of those are from our partnership with Mercy Health Lourdes. So that has been extremely successful. And I would say over 50% of those individuals have accepted some type of referral to treatment. And that could look like treatment residential, treatment with IOP, or simply follow-up services. The most crucial part that we do is providing them with naloxone and fentanyl test strips, which means that if that individual doesn't accept treatment and they just happen to have a return to use after that, they get a chance at life one more time to find their pathway to recovery. And I say all that as the director of Turning Point Recovery Community Center. I'm a person in long-term recovery myself. And I have a full team of people here that prove that we are worth an opportunity for multiple chances. It's frustrating, I know. The opioid epidemic is frustrating, but we're dealing with a drug supply that is 100 and 1,000 times stronger than what it used to be. So you can imagine how much more addictive that is. We have people on our staff that have been revived by Narcan more than 6 times, more than 10 times, and they are today now helping other people find their path to recovery. So again, this is what we're comprised of. This is what we do. We use peer support specialists to work with local law enforcement and health departments and EDs to combat the opioid epidemic here locally. And not only are we saving lives, our partnerships with all of these organizations have changed the perception of how our local government, our local LEOs and law enforcement are here to help. Sheriff Norman will call me saying, we've got a situation with this particular person and she's struggling or they're struggling. Can you help? And we do. It is a beautiful relationship because we're open to communication. And again, his leadership has made the difference. He constantly compliments us, and I appreciate that, that they couldn't do it without us. And I promise you, we couldn't do it without them. It's that synergy, it's that relationship that makes it possible. And as Dan mentioned a moment ago, those different sectors that make this possible is that partnership. We currently work with local law enforcement, the sheriff's office, to receive the referrals, the local health departments to work with them on outreach and utilizing their OD map access so we can identify hotspots in our neighborhood. We utilize our partnerships here in our own facility with mental health services like clinicians, social workers, and our local hospitals. That way we can meet those individuals when they're most susceptible to change. So with all of that partnership, we do make a difference, and I'm proud of the work that we're doing here.
Thank you, Brandon. I'm going to now have you have Pathways talk about the work that they are doing. Rodney and Crystal are on, and this might be a little bit of a refresher, and I do want to save time for questions. So I'm going to start with this slide, if that's okay, Rodney and Crystal, and I will let you all present.
Thank you. I'm Crystal Sammons. Are you going to introduce yourself?
Mine's Rodney Williamson.
We are the quick response team for Boyd, Carter, and Greenup counties in Kentucky. I am a person in long-term recovery, and Rod is a retired sheriff for 28 and a half years. So this slide was about collaboration. We get a lot of support from our 911 centers, our first responders, paramedics, The police, we couldn't do it without them. Oh, and also the health departments. I didn't add them in there, but they are a great asset to us. Next slide, please. We also do community events. We distribute Narcan, fentanyl test strips, xylazine test strips, snacks, information. We do Narcan trainings on the spot, or we can come to the organizations and do more formal Narcan trainings. Next. We go to our local schools. We train the school nurses and teachers on how to use Narcan. We have done assemblies to educate children about the dangers of drug abuse and other things, and what to do if they have a loved one in active addiction. Next slide. Okay, and that is how to contact us if anyone needs us. Rod, can you think of anything? Would you like to add anything?
Rodney, I just need you to unmute if you don't mind.
Can you hear me now? We've got two computers going in here.
Okay, well, I think I'm going to open it up to questions. This is just a slide to let you all know the technical assistance that we all provide at KCO. I've been in this position for about 13 months now, so please reach out to me. If you have any questions about the settlement, strategic planning, allowable uses, also examples and just peer examples like this, we are going to be continuing these education opportunities. But now I want to open it up to questions that you all might have for Rodney or Crystal or Brandon of how the QRT happens, or the sheriff or Judge Barnes of why that is something that they support. So I will look. You all can unmute or raise your hand, or we can put the questions in the chat, whatever. We have just a few minutes left, so.
Hey, Lauren, I would like to answer a question that I saw in the chat, if that's okay. And I
Yes.
don't want to take up
Yes,
too much
please.
time. But one of the questions was, and I can't speak on behalf of the sheriff's office, but they asked if there's social workers that had been hired on the local law enforcement. About a year ago, we had a good meeting with our local mayor. And they all decided to move forward on utilizing opioid abatement funds, since I know what that's kind of the topic here, to implement, I wouldn't say a QRT, but a deflection team, as Dan was talking about, within the PD. So they utilize those funds to offset a portion or the majority of their salary to hire in a social worker who had forensic psychology background, along with a officer who generally wears polos and kind of plain clothes, a little bit more relaxed. And they're actually working to combat SUD, opioid related issues, drug related issues, and mental health related issues. So that has been a pretty successful way that they've used that.
And Sheriff Norman, there's a question in the chat of why you started the Badges of Hope in 2018, which I know that was your predecessor. But if you want to talk about why it was important for your department.
Yeah, absolutely. So, like I had said, historically, law enforcement's answer has been, is there a crime here? If there's a crime here, then, do we need to take them to jail or charge them? And that was, those were our answers. Our answers was jail, or we'll talk to you for a few minutes, try to help you out with your problems, or point you in the right direction, and then we go on to the next call. And it wasn't working. So that's why the former sheriff created the partnership with the first treatment facility, and with the goal to overcome the barrier of where do I go and how do I get there. And so that's why we started that.
Thank you, Sheriff. Dan, there's a question in the chat about how counties can find out more about the programs that you all offer, like the QRT and situation table, and how can we elevate that conversation? And I want to also, I think that there was a question about can counties utilize QRT? This is an eligible expense for opioid abatement funds. And so Dan, I'll let you talk a little bit more about how to get involved.
No. And again, I think it'd be helpful to really quickly go over. I didn't share you in the state of Kentucky. You have law enforcement led teams, like what's happening in the city of Frankfort. You have community paramedicine EMS led with law enforcement partnerships in the city of Lexington. You have a public health led QRT in the city of Louisville. You have a hospital led QRT from down in Estill County. You have a partnership of providers and law enforcement in Powell. You have service providers. You have primary care of Eastern Kentucky leading in the Perry County and the Knott County service areas. So what that means is in the state of Kentucky, it's what is available. And like in Hardin County, I saw Justin here. In Hardin, the coroner is leading the initiative. The coroner's saying, we're going to be involved and we're going to lead this initiative. While you have behavioral health, you have public health, you have law enforcement, you have fire and EMS, you have peers up in Jessamine, in that Jessamine County region. The peers are leading that initiative for New Vista. So in the state of Kentucky, it's what is important, who's available and who can in the state of, in our community to make this happen. The conversations are, this is really firing off that conversation and kickstarting it possibly, being present and being available. I'll be in Pulaski County next week with the sheriff down there. They have a situation table. They want to continue to evolve and create greater service, understand collaboration. We're meeting there to talk about McCreary County, and the work that's necessary there. So again, it's really, I wish there was a way you say, we just get on a Zoom and we figure out everybody to bring in this, but really it's a community by community conversation, because every community has different needs and every community has different partners and a different willingness from folks like the sheriff, from the leaders within the behavioral health space or the treatment space. Where are we at our time and place within our community to discuss what it is that we're facing, whether it be SUD or domestic violence or whatever? It's a community by community conversation. That doesn't make it easy, but it's really helpful when you're talking within a community to better understand how to serve that community. So I hope that answers. And if you need anything from me, I'm out and about in the state of Kentucky. I also have a home in Southern Kentucky as well. And I spend a lot of time on 75 and then 64 and wherever else we need to go. So happy to have further conversations with any of you.
Well, guys, I don't know how we did it, but we got through all of that information in an hour. So again, I want to thank you all for your time and commitment. This is a very diverse conversation that has a lot of different solutions, but as you all know and you all saw, it is really community collaboration. It is working together, and it starts at a local level. So again, I appreciate your all's time today, and I look forward to continuing this education. And if you have any questions or anything, reach out. Thank you so much.